Okay, so dental caries, commonly known as tooth decay, that is what we're looking at. So as I said, it is a bacterial disease that affects mostly the inorganic section of the teeth, which is commonly the enamel, and also after now affecting it through demineralization, we also have further destruction of the tooth by the organic part now being destroyed. Now the other parts like the pulp of the teeth and also the dentin section. So first of all, we all know, I think from the anatomy we talked about, that the enamel is highly calcified. The enamel is this section here. So it is highly calcified. So it's made up mostly of the inorganic components, that is calcium and also the phosphate. Okay. So, and by the way, the enamel is the hardest, let me call it, yeah, that is the word. It's the hardest tissue, or it's the hardest part of the body. Okay. It's more harder, as in terms of how thick and how strong it is. It is more harder than even most bones. So that is the teeth, that is the enamel for you. And what makes it very strong is the inorganic component of it, that is the calcium and the phosphate that is there. So what we're talking about when we start talking about dental caries is that now that area starts being affected by bacteria and other things that we look at. Now, after that area has been opened up, we get access, or bacteria gains access to other sections of the teeth, now the organic sections, okay? And now it causes more damage. Remember, we have nerves and blood vessels that now are in the pulp, and also some protrude towards the dentin region. This is the dentin region, and then this is the pulp. So because here is where we have the nervous supply, that is where now we start feeling the cold, the sensitivity in terms of pain when you drink something very cold or very hot or very sweet. So that is what basically happens. So this disease is also what we normally call tooth decay, and it's one of the major causes of loss of teeth. So in terms of etiology, I know I've tried to maybe mention some things like bacteria and other things, but the other things that predispose one to dental caries. So first of all, like the diet in terms of a lot of carbohydrates and sugary content food. Okay, so diet that is high in sugar and the carbohydrates, they provide a very good environment for formation for the attachment and providing food for the bacteria to actually settle on the surface of the teeth. So with that, then it ultimately provides a good environment. Another thing that you will see with carbohydrates is that normally, like, one of the main causes of this disease is that now we have demineralization. And how does it happen? Is we have the bacteria, and some of the bacteria that we're talking about are like lactobacillus, which causes the breakdown of sugar and produces the acid. Okay, so it is able to break down the sugar and produce some acid, lactic acid. And what that does, it reduces the pH. Now the pH being reduced and making it more acidic, that one makes it able for the calcium and the phosphorus to actually dissolve. Okay, and that is why now the enamel gets eaten away. So I hope we will explain that in depth. But the point is, now sugary food, or people who like snacking so much, they take things that have some sugar content, they are actually at risk of developing this kind of disease. Another thing is also still on diet, like when you're taking fluids, like juices or soda that is acidic in nature. Like just take the normal Coke or something. Coke has high levels of sugar, and it is acidic. Okay, so that acidity and the sugar, it provides a perfect environment. Okay, now you might argue that some bacteria, normal bacteria, will survive in optimal pH. That is very true. But now the acidity in the fluid, like Coke, it gives a stronger hand to now this pathogenic bacteria, okay, like the lactose bacilli that actually now works on the sugar, breaks it down, makes the lactic acid. But now the other normal bacteria that will be in the mouth, the normal ones that will not cause a problem, now they die, okay, providing now even more ample time and even food, because there's no competition for this bacteria to continue growing and even feeding and producing this lactic acid. So the point is, the diet that is high in carbohydrates, sugar, and also fluids that if you're taking things that are highly acidic, then they usually like affect our enamel. And even just take, for example, you yourselves, when you've taken soda for so much, even not so much, just when you've finished a bottle of soda like Coke, how do you feel on your teeth? Like, even when you're trying to grind, it feels like there's some difference in it. It's not like the normal way. It's because that acidic nature of it has affected the enamel a bit. So that is carbohydrates. Then we have plaques of bacteria. Last time when we talked about gingivitis, we said when we have our teeth or a tooth here, and then now we have deposition of bacteria. Okay, so it forms several colonies of bacteria. Now when these colonies now merge up, they form like a film. And we also called it a biofilm, if you remember very well. So these are what we're calling the plaques. Now these ones now provide a very good avenue for the, imagine now if this film or this plaque is made up of bacteria that is now breaking down, for example, sugar to produce lactic acid. And then now that causes destruction of the enamel. So it becomes even very difficult to kill it. So bacteria also in itself, or the plaques of bacteria or the biofilm, is also a predisposing factor. Now there are people who have susceptible tooth. For example, if they have had a prior procedure, for example, like a filling, or they had a prior before, they had dental caries before. So they are at more risk because already their tooth, for example, if the tooth was broken somewhere here and filling was done, then there's still a risk for actually having another infection there and then having a destruction of the enamel even further. We normally call it secondary dental caries. So a susceptible tooth is also a problem. Then absence of fluoride and saliva. So people who don't like brush their teeth with toothpaste that has fluoride, then it causes some problem, because now fluoride has main two functions. Like fluoride is also acts against the bacterium, and also the fluoride provides some elements that now help to build up the enamel. Okay, so it helps to strengthen the enamel. Okay, and you'll see one of the management we'll talk about later on is we have something like pasting. People are applied topical application of fluoride. Okay, it's like they are pasted some sort of fluoride on top of their teeth. So absence of fluoride now gives a chance for the enamel to be destroyed, and then we have dental caries. And then also we can have saliva. Now absence of saliva. Now you might wonder, why do he have now absence of saliva? Why? Now there's some people who might have conditions that might reduce the amount of saliva in their mouth. Now saliva, as we talked about, we said the constant supply of saliva, it keeps washing the teeth with saliva there. It removes some of the organisms or some even of the stuck food material. So saliva is very important also for the health, or for the oral health. So if we don't have enough saliva, or if we are having absence of saliva, then we might have some sort of problem. Okay, good. So that is just some general kind of etiology. So if we get now some into the pathology, and this is I've mentioned some things about the pathology here, is that first of all, the disease that we know as dental caries, it's regarded to as a disease of the modern civilization, because prehistoric men rarely suffered from this disease. As in, we don't have a lot of record of the old people, or during the old times having dental caries. And when I say old times, I don't mean the times of your grandfathers, in very, very old times. Okay, and you can just, if you think about about it logically. It's not like they didn't have bacteria. Yeah, they had the bacterium, but maybe their diet mostly was not as sugary as what we take nowadays. Think of the diet nowadays. Everything has sugar, left, right, and center. Whatever you take has some sort of sugar. We take a lot of juice and soda and other fluids that actually are very acidic. Okay, so the diet has really changed between that time and the modern civilization, and it has really affected our dentition. And with that, then it has affected now why we really get this condition. Now, it's this whole thing is a biological process, and it's multifactorial etiology. Okay, like if you whatever etiology I've given, you need, for example, to have something that will break the enamel. Okay, something that will cause destruction of the enamel, and then together with a bacteria. Okay, it's not like a one-off etiology. It's not like just need bacteria for the entire thing to happen. Okay, so it is different factors contribute to the condition. Okay, so basically whatever happens is that we know it's a microbial disease of the calcified tissues of the teeth. Okay, now a difference with it, obviously, if you think of gingivitis, whatever inflammation we were having inflammation or the bacterial infection, it was starting from like the gums or the tissues that are there, okay, within the gums, not the calcified tissues. The calcified tissues are is the enamel. In this case, what starts the infection? The infection starts in the enamel. It doesn't have to be at the center here. It can be at the side, but it has to be at the enamel. We don't start from the gingiva and then it growing up. No, it starts from the enamel and then going down. It can start from the enamel and proceed up to the dentine pulp and then get to the root completely and then starts affecting the gingiva. Yeah, that can happen. Then we start having periodontitis. But the point is the infection or whatever thing that is happening, the destruction starts in the enamel. Then we have demineralization of the inorganic portion, and then ultimately we have destruction of the organic substance of the tooth. Okay, so just to have this, I try to put up this so that we can see the entire process in a more systematic way. Is that you have a susceptible tooth. Okay, so whichever problem you're having, whether you're having plaques, whether you had a prior dental caries, whatever, you have a tooth that is susceptible. And then the assumption is that we have now a biofilm of microbial agents or the bacterium. Now the bacterium, as I said, now if you now add something like sugar, we have production of some acid. Okay, that acid changes the pH. Obviously, the pH goes down. Okay, and normally anything below 5.5 is a problem. Now, this pH changes the dynamism of the minerals, and the minerals now dissolve. Okay, because of the change of the pH. Now, that means the calcium and the phosphate that we have, they dissolve. That dissolving causes some cavity. It causes a cavity because if this is where we were and the enamel is a bit strong, so that is the enamel, then we have the dentine, then we have the pulp. Okay, so if this is the enamel that we're talking about, now it continues being eaten. Demineralization happens until now it's broken. We have like a cavity form. So a cavity forms, and then ultimately now this cavity, now remember it's the bacteria, it gives more time even for bacteria to continue going down, goes to the dentine, goes to the pulp cavity. So with all that, we start having inflammation or infection. So we have inflammation or infection occurring. And that is where now you start having pain or sensitivity. Okay, because remember you have the nerves now here. Okay, now it can continue, it can even go up to the root completely, and then now starts affecting now the adjacent structures now, and then it can even lead to periodontitis. Okay, and what you need to know for this case is that if you know that first of all you have a susceptible tooth, and then that tooth gets some sort of microorganism, or it has a microbial film, or the plaque, what we call it. Now, because of that, then we have some acidity being there, which changes the pH, which allows dissolving of them, of the minerals, and then that leads to a formation of a cavity, and then that is now what we start calling tooth decay or initiation of dental caries. I hope that area is quite clear. So we will look at the different types or different classification of dental caries that we have, but generally the progression is just what we've talked about. Now imagine this is a caries that has started here. So the enamel is being affected. So that is called enamel caries. Okay, that is where it starts. Then it progresses. Now you see, it now passes through the enamel. Now it goes to the dentine region, so that it becomes the dentine caries. Now the dentine is just adjacent to the pulp. So then the pulp becomes infected, and that is called pulpitis, infection of the pulp. Remember, the pulp, you have the nerves and blood supply. So that it can even go to now the roots completely and starts affecting the adjacent organ. Then we have periodontitis. Okay, so we can have such kind of a progression of dental caries. So classification, this is not so important, but just to show you, we can have different types of dental caries. We can have different classification based on the nature of the attack, how it progresses, the number of surfaces that have been affected, the location of the lesions, and so on and so forth. So it's not like very important for your level to know all these different types of classification, because ultimately the event will be the same. There will be pain, there will be a sensitivity, and all these things. So it really doesn't matter at this level what type, or for example, what is the location, or what are the number of surfaces. Yeah, it might affect how severe or how aggressive the management is, but this is just to understand the different types that are there. So I just decided to look at a couple of them, just a few of them. The rest you might get some time to go and read and appreciate the different types. So based on the nature of attack, we can have primary caries, and this is the initial one. If you've never had dental caries, the first attack that you have and you start having it, then that is what we call primary caries. So for example, you've had very healthy teeth, and all of a sudden, but not all of a sudden, because this thing is a gradual thing. So after some time, because maybe of poor hygiene or something, or because of your diet and how you are taking out of sugary content and all that, you start having that attack. So that will be deemed as a primary caries. Then we can have secondary caries, where now you had a primary caries, and it's sort of following your now intervention in terms of good oral health. It sort of like disappeared, or there was management that was done, for example, filling and everything, and then now it still reoccurs. Now when we have a reoccurrence, that is called a secondary caries. Now you can see here, for example, there's a filling in this patient's teeth now, but you can see there's some sort of blackness that is appearing at the margins. Now that will be now termed as secondary caries, because the primary one was dealt with, but now this is an emanation of another one, okay, following the management of the first one. Then we can have another classification based on the progression. So it can be acute, that is rapidly invading, and it involves several teeth, okay? And you can see an example here. So this is what we'll term, it occurs very fast and it has affected several teeth. This will be termed as an acute caries. Then we can have chronic caries. This one is long-standing, it's there for some time, but normally it affects like one or several, just few number of teeth. And you can see this one here, the caries is inside there. Then the surface also involved, we have different surfaces of the teeth. As I told you, we can have, it's not a must that you have your caries are along the fissures or the pit of the teeth. You can even have it starting from the side. Okay, so we can have pit and fissure caries. We can have smooth surface caries, like the ones that are on the side of the enamel. Okay, not at the top surface of the crown. So as you can see here, we already have some caries of the cavities on the pits and fissures of the teeth. Okay, we can also have classification based on the number of surfaces that have been affected. Here you can have simple if it's only one surface, okay, one side of the surface. Compound if it is two surfaces. So you can see here like from the top and then the side. Okay, so this is the side view, and then this is the top. So there are two sides, two surfaces that have been affected, and then we have complex where it is more than 3 areas. Okay, and this one is totally, it's very bad. Then after that, the another classification is we can have based on which tissue is involved, and I think I showed you the different types here. We have enamel, caries, if it is the enamel which is affected. When it progresses, we can have denta, and caries can even get to the cement, okay? The cement region of the roots of the teeth. Okay, so this is just based on which tissue is affected. Okay, I think I've talked about those 5, and I listed so many. You can go and read more on the other ones and appreciate them. So what is the clinical manifestation? It's quite straightforward, and I think most of you have seen this. So these people will have pain on the tooth and sensitivity. And sensitivity is to hot, cold, and mostly sweet things. So if you're taking something that has a lot of sweet or sugar, for example, like a cake that is very sweet, you will feel that pain. Okay, that is an example. That is telling you that you have a cavity on your enamel. Cold substances, again, they make you feel very, you feel a lot of pain, and then hotness. On top of that, there is discoloration of the teeth. I think you've seen the blackness there, and sometimes roughness of the teeth. And then there's tenderness or inflammation of the mouth, or even of the gums that are around the teeth that have been affected. Because especially if we have the whole thing progressing to the root, and then starts affecting the gingiva and the surrounding tissues. Okay, so it's quite straightforward. You not even really need a lot of things to just inspection of this. Then you'll be able, and getting some subjective information from the patient, you can really tell a lot. Okay, so some possible interventions. I'm calling it possible because it depends with what is the problem. So if bacteria is the issue in this case, so we have to reduce the number of bacteria like Streptococcus mutans that are normally there, okay? And this can be done in several ways. For example, you can be taking, you can be gargling fluids that have antimicrobial agents like chlorhexidine and all that. And also reduction in sugar intake, because now this gives bacteria food, and also now it enables the bacteria to break it down and produce the lactic acid, which now dissolves. The acidity now leads to the dissolving of the minerals that are there. Then just active or passive immunization. Okay, now so that is basically one of the interventions. So your immunity is basically supposed to also help you, because if it is also not for your immunity, like then you'll not be able to, as in basically almost everybody will be having this. So again, a good immunity is good for some sort of prevention here. Now if we go to caries, now another possible intervention is reducing the intake of it's particular sucrose. Okay, this diet is the one that is supposed to be here. So this is diet. Okay, diet is also important in intervention, as in you reduce food that is high in sugar content, and also food that is also acidic. Okay, mostly not food, like fluid. Also time. So avoiding frequent sucrose intake, that is constant snacking, and trying to stimulate salivary flow. But there's some, for people who have dry mouth or they don't have a lot of saliva, can be given fluids that are saliva-like, because saliva has several components. So it has the fluid section, it has mucin, which makes it a bit thicker, okay? And even the antibody, it's immunological purposes. Okay, then we have people who are susceptible they have to be given water. Okay, they have to be taken out of water, and that helps in washing out some of those things. And fluoride. Okay, fluoride will help in strengthening the enamel. And prevention during post-eruptive maturation. By the way, this is an important point. We have posterior eruptive maturation. Now, you see, by the way, the time that, if this is your gum, and you have the teeth coming from, you have cells that enable the formation of enamel and other parts of the teeth. So the enamel is formed by these cells, and then so that now when the teeth erupts, it just pushes the enamel out, and now that's how the teeth comes out. Now these cells, you have to understand, these cells are one-off. Once the enamel comes up and it erupts from your gum, and now it's up there, those cells, they die and they don't come back. They cannot be regenerated. And by the way, and that's why this disease, by the way, when you get to advanced stages, it's irreversible. Okay, it's irreversible, meaning once an enamel is destroyed, that's the end of the enamel. Maybe now you start using other artificial things, like now you do some filling and other things. You put other things, but now the natural enamel has been destroyed, and that's it. There's nothing you can do to reverse that. These cells are gone. Okay. Okay, that's the reason why at your age, if you lose some teeth, then that is it. You don't have, maybe you get some temporary ones or artificial ones, but the natural one, that is it, because these cells, they die and they do not regenerate. Okay, then we have fissures, sealing. If you feel now those areas that have the fissures, okay, to prevent the cavities from becoming even big and bigger, then that can also be a good way. Then we have other restorations depending on how bad it is, like for example, a root canal and all that. In terms of prevention and even some sort of management, is that depending on how bad it is, restorative treatment can be done. An example is a root canal. Okay, I don't know how many have undergone a root canal procedure. I don't know how many I've seen, but that is one of the restorative treatment that can be done, but it also depends with how bad the dental caries is. Then we have toothbrushing. It's important for physically removing the plaques. Mouth rinsing, that also works. Chlorhexidine mouthwash, with its antimicrobial capabilities, it helps to remove some of the microorganisms that might cause the problem. Dental floss, I think this is for those of you who maybe don't know dental floss. This is what we call dental floss. It's a physical removal of like solid particles that might be stuck in between your teeth. So that is what we call flossing. Then we have topical fluoride application, and this is what I'm referring to. This is the topical fluoride. It's like you're painting your teeth with the fluoride. Okay, it makes it now even stronger. And then we have pit and fissures sealant. So you have things that seal the pit. So if you can see, this is a pit. They're quite visible, but here I don't know how you can see. If you can see, it's like filled with there's some whitish substance. Okay, so it's just filling those areas of the fissures.